A mommy makeover operation is a very common procedure. Everybody wants to know what is involved in a mommy makeover, and it's typically to restore the shape and appearance of a woman's breasts and body after pregnancy. So there's more than one procedure that we do at the same time in order to address all the areas that get affected from pregnancy and childbirth. So this very often includes a breast lift or breast reduction or breast augmentation, and at the same time, abdominal surgery like a tummy tuck and liposuction to restore their waist and their abdominal appearance to improve their overall figure and basically put things back to where they were before, or better yet, to make them better than they were when they started. When you come in for a consultation for a mommy makeover, we're going to evaluate and examine all the areas that you're concerned about, and typically it's the things that have changed during or after pregnancy. That's going to include your breasts, and it's going to include your waistline, your abdomen, your hips, and sometimes also your buttocks. And the procedures that we can do to improve these areas are going to include liposuction, fat grafting, a tummy tuck, tighten your abdominal wall, fix the muscles of your abdomen to make it nice and strong again, improve your figure and your waistline, and at the same time address your breasts, using the same type of techniques that we might use for cosmetic breast augmentation with a breast implant, or a breast reduction to make your breasts smaller, and or a breast lift to make them tighter and lifted at the same time. And when we combine all those procedures together in one operation, in one day, we call it a mommy makeover. A mommy makeover surgery will typically be a little bit longer than one single breast surgery or one single tummy surgery because we're adding multiple surgeries at the same time. It could be 4 hours, 5 hours, sometimes even a little bit longer. Typically you would go home the same day, and the recovery is approximately 2 weeks if we're combining surgeries. You're going to be up and walking on the very first day after surgery. You're going to take some painkillers for a couple of days, but you'll feel fine after about a week. You have to avoid any strenuous physical activity or exercise, or to stay out of work for about 2 weeks' time. And by the time you're a few weeks out from surgery, you'll be able to go back to all of your normal activities.